because I don't want all of you to keep waiting for the lunch. And just to introduce myself, I'm Dr. Ayesha. Professionally, I'm a physician who's too much passionate about public health, who's now turned into an administrator. I work for Apollo TeleHealth division, who focuses on the people who cannot come to Apollo because of maybe the distance, accessibility, or the cost and affordability aspects of it. So we are a division who's trying to bring the quality healthcare that Apollo is known for by using technology, basically. So we are a telehealth company. The backbone of our whole healthcare service delivery is technology. Okay. So Apollo Remote Healthcare, we have got lots of different programs, products, and services. So as you can see, we run a lot of teleclinics. We have tele-emergency. So where somebody was talking that in the panel that having an air ambulance is very difficult. So you need not have an air ambulance. You just have tele-emergency and you can stabilize emergency patients even in Himalayas, and that's what we do. So teleradiology, teleophthalmology, there are so many projects that we do. I'll just go through one by one. Before I begin explaining you the products and the programs and the services that we have, I would just like to share what we have achieved till now. And then maybe after I tell you where all we have achieved it, then I'll also tell you what all problems we are facing right now and how do we want to enhance technology that we are already using to make sure that we are reaching much farther, in a much affordable way. So we have touched till now more than 11.6 million lives. So when I say 11.6 million lives, it is just in the last 4 years we are able to achieve this. They're all unique patients. Most of them are in the primary healthcare setups or the secondary healthcare setups. We have access. The patients are accessing our services from 48 different countries. We are present in 25 states of India. So when I'm talking about this is not Apollo Hospital that I'm referring to. This is Apollo Telehealth services that I'm talking to you about. So on a day-to-day basis, 20,000 transactions is what we do. These transactions will include teleconsults. They will include pharmacy, the laboratory services, and you name it, it is all part of it. We are also working with a lot of government agencies. So one of it is Common Service Center. I'm sure you all might have visited Me Seva Center in Telangana. So we are present in 250,000 of those. Though right now the CSCs across India, 350,000. We have enabled our services through those village level entrepreneurs in 250,000 Gram Panchayat level Me Seva centers. People across all these villages can access our services. They can just get connected to an Apollo doctor in less than 10 minutes wait time. Okay. We have actually started first VSAT-enabled emergency center in Himalayas. It is 14,000 above the sea level, 6 months. You just can't reach there because of the snow. The roads are cut off. We provide services there, and we are doing this since last 4 years. A lot of lives saved, a lot of emergencies handled. It gives a lot of satisfaction to us, and now because of the service, we are expanding in Himachal even more. So when I was talking to you about the 25 states that we are there, so all across these 25 states, we have more than 650 teleclinics. We are present in primary healthcare centers, community healthcare centers, and somewhere in the district hospitals also. So what we do is we empower the local staff there to do better services. In few projects, we have taken up the whole infra, and it's a turnkey solution that we provide. So we have done more than 1 million specialty consults through this 110 franchises that we have, which are not part of the PPP models. We have franchises across 17 countries. And also we are very much using the technology in conducting continuous medical education. And this is for people outside of our organization, but also inside our organization. We have a very good learning culture in the whole teams that we have. So we use LMS system all across our learning managements that we do, and because of which we are able to achieve very better results. And this, we were talking about the empathy training for these healthcare providers. So that's definitely a very important module that we deal with our healthcare providers. We also have a 200-seater contact center. So here, we handle the queries of the patients. They can call us, they can book appointments, they have a query, they can ask us. This is also adding a lot of value to us. So 10,000 calls are answered on a day-to-day basis there. So when I'm talking about the hub here, so we are located in Hyderabad as an head office. So at our hub, we have 600 doctors. So 300 in the hub sitting and doing teleconsultations. So these 300 doctors come across from 16 different specialties and super specialties. We have 300 doctors who are working in the field, giving direct consultations to the patients. And I'm really proud and happy to say that all the doctors are EMR friendly. They are not scared of technology. They love the technology. And because of them and their inputs, we are able to enhance our application on a day-to-day basis. So when I look back 10 years, when I began my journey with Apollo TeleHealth division, so I look back and look at the EMRs that we have at that time. And now when I look at it, it's a sea of change that we have seen, and it's all thanks to the doctors that are working with us. So that's why I was telling that we did not explore certain technologies, because we do not have that problem right now. So 3,500 plus teleconsults from GP to specialty to super specialty are being done. And I take pride in saying that I can challenge this to anybody, that no hospital will tell you that I can give you a consult in less than 10 minutes. We do that. Across 25 states, the average wait time a patient has to wait is not more than 10 minutes. And these are all free consults for them. It's all paid by somebody. So it's not that it's a government facility, so government is paying, the patient is not important. It's not the case at all. So we make sure that the patients are not waiting and getting a much better treatment than any private hospital that they would get. So we also run some counseling services, wherein we give counselings about the chronic diseases and different other conditions that I'll be talking. So on an average, we always have onboarded some 5,000 clients with us. Then we have a very strong quality and training team, which is, which makes us a little different from others, because we take a lot of effort in understanding what gaps we have in our system. So we have a complete dedicated quality audit team which does minimum 900 or more audits on the consults that are happening. There are audits, process audits that are happening which are not part of this number, but 900 consults on an average we audit. So all these audits are, because we are a technology company, we use our video solutions. All the transactions that a patient and a doctor are having are recorded and archived. So we have much more deeper insight on what happens between a doctor and patient, because it's all recorded and you can always go back and check. And with this feature, we have realized that the usual EMRs that we have don't capture those minute details, which actually matters a lot in delivering the precise medical advice to the patient. We also do a lot of CSAT callings for our patients, because we feel that if you don't listen from your customer, then you don't improve at all. So we have an IVRS system which takes an automatic feedback from them, because we wanted some non-biased kind of feedback to come to us. But then that feedback was not helping us getting into the minute, granular level kind of information that where exactly went wrong. So we have a dedicated team of executives who call these patients. Before they call, they go through the whole EMR piece of it and understand what was done for the patient, and then try to take a feedback which is very specific in nature. The feedback ranges from whether the doctor was empathetic, whether he spoke to you in the language that you needed, whether the medicines that we prescribed, did you get that? So it's a huge lot of, big questionnaire. We request people to be a little patient with us, because at the end, it's they who get benefited out of it. So in this clinics that we have, we are also established small-scale laboratories, which give you at least 50 kinds of tests are accessible to the patients there. So it's nothing less than going to a corporate hospital and getting your health check done. So all those things that you will get as a health check done in any corporate setup, that is made available to patients free of cost. And again, the major USP of this is there are two things to it, that we have a quality control partner, CMC Vellore. So we make sure that the reports that are going to the patients are of highest quality. And the second most important thing is that Patient don't have to come back to us for the reports. If they have a little bit of time, like an hour or so, they can just sit there, take the report and go. And if there is a need after that to do a review, they can just do then and there. So the turnaround times are something which we are really working towards, and we want to make it as real time as possible. Because we see that a lot of time, people are not trying to take the services back from the healthcare service providers because they do not have time, or they have gotten something much important, because patients don't understand that health is the most important thing. We also have a teleophthalmology project, which I'll talk. So we deliver 2,000 plus spectacles on a day-to-day basis in a state of Andhra Pradesh. We also do more than 500 fundus screenings on an everyday basis. And then, as I said, we have a training team. So on any given point of time, we have 3,000 plus employees. So minimum 8 training sessions continue to happen on a regular basis. So this is the project that we started in our PPP model. So today we had a discussion on the public-private partnership. I have a very positive opinion about it, because I feel that this is the way this is the way forward for all of us, because government setups, whatever enhancements happen in the infrastructure, or the funds get added to it, it will take long time for us to scale up and provide the quality services to the people. I feel PPP is the way to go forward, and we are, I think, the largest public-private partnership players in India right now. We have Electronic Herbal Primary Health Center. This was a turnkey solution that we provided to the AP government. The major things that we have done here is that from the infrastructure enhancement to making sure that the patients are feeling that they are respected and valued, and they are not coming to a government setup where nobody bothers about that. That was taken care. They have an AC waiting hall. They have nice, cool, chill drinking water available there. And all this project, we are monitored on the performance indicators live on the CM dashboard. So any day, how many people were there on the clinic on time, to how many lab reports were given on time, to how many teleconsults happened in less than 10 minutes of time, all that is tracked on real-time basis. And this project, we have ISO certification. We are connected with CMC Velo for our laboratory quality monitoring system. And in this project alone, we have 200 plus people employed. So the teleophthalmology project was again a very unique project that we did we are doing for government of Andhra, wherein people come and get their eye testing done for free. And then after that, if they need a spectacle, that's supplied to their home. They don't have to come back to the hospital. Their spectacles are supplied to them at home, and these are all not like a reading glass kind of a thing. These are all made to order glasses. So that's happening in Andhra. And then at the same time, because we understand that NCDs are, the thing everybody is talking, and diabetes is so much prevalent. So diabetic retinopathy and hypertensive retinopathy is the most common things right now. So we do a fundus screening also for them, and the report from an ophthalmologist is provided in less than 5 minutes time. So by the time patients, just take care of their belongings and are ready to go, the report is already there. They don't have to wait for it. And we have deployed an AI algorithm on this application, wherein we are, because of the machine learning thing, the images that are uploaded by the optometrist, they are graded by an AI, whether they are good quality or not, so that patients, don't get into a trouble that the image that was taken of the fundus was not bad, and then some more time gets wasted in taking one more image or so. So AI plays a vital role. So it's helping us diagnose better, save time, and it is also helping us train the optometrists there to take better images of the fundus. So we are running a digital dispensary in Jharkhand. I'm sure you all know that Jharkhand was one of those states which were called like Bimaru states. So it is the most toughest terrain to work in. So we are located in the most remotest part of Jharkhand, wherein we never had electricity there. We had to use somewhere solar energy. We had to enable that, and then finding manpower. The trained manpower was a nightmare for us. We were not able to get the manpower, and then the training team that was there we had to teach them from how to start a computer to now entering and handling an EMR and the point of care testing devices. So here we provide primary care consults to them. And also we have a laboratory setup wherein we are using the point of care testing devices, which have, I think, the most important technology I think we all have to look forward to, because that will enable people to do better diagnosis and better treatment at maybe a fraction of cost that we spend right now. Tele-emergency in Himachal, as I said, you can see in the photographs also that that's how the whole area looks 6 months in a year. So a lot of people have taken it as a example to be followed in the different countries. And in Uttar Pradesh, what we are doing is we are located at a CHC. We have realized that I think the government of Uttar Pradesh wanted to enable their doctors to do better diagnosis. So we have enabled 13 different kinds of specialities available at the CHC level, because all of you know that there are only 3 or 4 kinds of specialties made available at a CHC. Footfall is nothing less than 400. And there are a lot of times that a doctor feel that they needed a second opinion or they needed some kind of support. So 13 different specialists and super specialists are connected here. And in the initial 6 months of this project, we realized that there's so many TB cases, there's so many leprosy cases about which we feel that leprosy is almost eradicated, that's what the image we carry in our minds. That was not true. So in the initial 6 months, we were able to diagnose more than 200 leprosy cases, more than 400 TB cases. So we are now giving all this information back to the government for the follow-up, because that doesn't fall in the purview of our scope. So it's a lot of work together that's happening right now. Because of using of technology, we are able to track these kind of high importance patients and then handhold the government to do their works. So these are other small projects that we have, but they're very unique in their nature. Like we are present in NTPC Bongaigaon. There's again tele-emergency, tele-speciality, tele-laboratory, you name it, all those services are made available. There are only some 2,500 people living in very remote areas, no access to the healthcare right now. This area used to be a place where nobody wanted a posting because there was not even a healthcare service available. But after 2 years, there are people who are queuing up to get their transfer to this place just because healthcare is taken care. So we have B2B programs also. We were talking about mobile being used for connecting to the doctor. So we have a platform by name Ask Apollo, on which you can just get connected to a doctor from your mobile, from your home's comfort. And also we are having a smart health kiosk kind of a thing, wherein people can use it in the communities. Maybe in a gated community we can put that, and people can access doctors and get their basic tests done through this kiosk. So we also have condition management programs. As I was telling you, NCDs are becoming the major burden, and then we have realized that people who have diabetes or hypertension or any non-communicable disease, the problem is not the disease itself. The problem is they don't know what's happening with their bodies, what they're supposed to be doing, when to go to a doctor, what should they ask from a doctor, what should they eat, what exercise they can do. All that is considered in this, and we have separate segregated programs, and we were just doing an impact analysis of these customers that are with us. We have realized that over a period of 4 months, we took like some 200 subjects to understand and do this impact analysis, and we realized that their sugar levels have stabilized, their stress levels that they perceived, stress levels have gone down because there's somebody that they can talk to, and also their physical activity levels have gone down because there's somebody nudging them all the time saying that, did you do this? Can you not do this? So that's how we feel that this is going to be way forward for all of us. So continuum of care needs to be established, and I'm very confident that technology will help us do this in coming days. We also do in the discussion in the morning. Somebody was suggesting that CSR funds needs to be utilized in healthcare. So there are a lot of players already who are utilizing the CSR funds in healthcare sector. So we partner with them and we make sure that we are implementing their CSR projects. So we have a very huge CSR project running since last 4 or 5 years with Landmark Group. And we have screened more than 3.5 lakh people for diabetes, hypertension, dyslipidemia, and anemia. And there are so many, heart-touching stories there, wherein these are all people who are below poverty line, or maybe work, lower middle class, where they did not have access, or maybe they did not even think that it's important to get tested, and how the life changed after that one test that was done by using a POCT device, how they changed after that. So we are also doing a project in Tua, that's in Gujarat. So again, it's a very, very remote area. It's again a project where we want to understand that how using technology we can create access and make it affordable also at the same time. So all this we have done till now. Doctors have been great with us. The paramedics, we could find and we could train them, but then there are certain learnings. So because we are talking about technology today, I thought that we should also discuss about the importance of health informatics, because now digital policy of India is coming into shape. There is a national health stack being created. So what we have experienced as a problem right now is that wherever our doctors are working on field, we see that a lot of data is manual. So we don't get a lot of insights. And wherever the doctors are sitting on the technology platform using it, 85% of data when we started was of no use. I think you all will agree that though there's a lot of data gets keyed, it's of no use. You can't read it, you can't understand what it's saying. So there were a lot of problems on three aspects of it. Doctors were facing problems, patients were facing problems, and community itself will get affected when these two are not in sync. So doctors always have this thought that there are so many data points that we are asking them to enter, and they feel that, again, that empathy is going for the second line, and then we're not worried about the patient. It's all about the EMR. Then they were, every time we talk about AI or ML, doctors have a feeling that, oh, you're trying to replace us. It's not that. But then that's the feeling, and they feel that, and we also understand, all of us understand that how much ever technology comes into play, doctors cannot be replaced, a nurse cannot be replaced. They will have to be there. Last thing was what we have seen was the physician fatigue. So everybody wants to see maximum patients, everybody wants to use EMR, but then nobody was bothered about the physician fatigue that was setting in. From their patients, and we understand that they don't understand what UHID is, they don't understand what important data points that they need to tell a doctor to get a proper diagnosis out of it. And then because there are so many platforms, even if you're on a digital world, that there's no health profiling that can be possibly done. So, and at the community level, when we tried to look at the data to understand and maybe do some kind of activities, suppose that we saw that there's no statistics available to design a personalized healthcare right now. And also patient satisfaction was definitely not taken into concern whenever and wherever we were working. So, and clinical care efficacy, that was the thing that was the most bothering part for us, because when we were doing audits, we realized that there could have been a lot of things that could have been better, much more accurate and much more impactful. So these were the problems that we were facing. So now what we are planning is this. We don't want to use artificial intelligence right now. We have tried using it. We will use, but then right now the focus that we have today is that augmented intelligence. So what we are trying to do is create some training tools so that the paramedics and the doctors, because they also need some kind of refreshment in their learning. So that's we're trying to do that. And these training tools are not like a training session kind of a thing. The training tools are integrated on our EMR. So whenever they are doing something, there's an alert that pops up that, doctor, do you want to do this in this way? Then risk calculators, definitely that are needed, because that gives an insight to the doctors on what kind of areas that they need to look at. And we have also designed a clinical pathway guideline for them, so that everything is not necessary that they remember. They can always take help from the tool that's available. And in the EMR, what we have done is that we have given them critical information highlights, so that if somebody is diabetic, hypertension, or maybe on some kind of antiplatelet medicine, it is thrown to them very obviously, so that they don't miss it. And then there are a lot of alert systems for patient, for doctor. Like if a doctor is just going forward without checking the previous EMR, we give them an alert saying, the doctor, do you really want to miss this piece? That checking the previous records are really, really important. So what we are trying to do is augment the doctor services. We are not trying to tell doctors that you become faster. We are automatically making them much faster, much better, much efficient, and much, very specific in their approaches. And then we have also made sure that the EMR that we have, the data capture that happens is very, very, very specific so that analytics can be done later on, because that was a major area of concern for us. There's so much of data, but we were not able to understand. And right now the government, working with NHM and a lot of other agencies of government, we have realized that government is also focused on impact analysis. You do a project, you do any activity, they are asking you what impact you created. Unless and until you have a very hygienic data, you can't show impact. So I'm getting a note that I need to finish it faster. I would have loved to, talk a little bit more about it. But then, I'll just talk about one or two tools that we are using right now, and that is that we are trying to calculate the empathy score of each consult. So that we have realized that there are doctors who take too much of time. There are doctors who take very little time with the patient. We want to give them that tool which gives that doctor, we think that you spend very little time with the patient. You might have a valid reason for it. Maybe the patient came for a review, but we want to give them those alerts that, and then an empathy score for that this consult of yours was scored this much. Because it's all happens on the video and audio, we have those kind of tools to do that. And also because when we are giving these tools, we are making sure that the doctor is learning on itself and their images are increasing. We have developed a system wherein patient feedback, doctor's quality score, and empathy factor create their performance score basically. So that's how we are looking at it, and there's a lot more, but I think for the time's constraint, maybe next time. So what we are looking at is to augment doctors, paramedics, and patients in their interactions, and just make sure that we are not missing anything critical. We are creating a very good patient experience and a doctor experience. For us, doctors are also very, very important. Thank you so much. But then right now, the focus that we have today is that augmented intelligence. So what we are trying to do is create some training tools so that the paramedics and the doctors, because they also need some kind of refreshment in their learning. So that's we're trying to do that. And these training tools are not like a training session kind of a thing. The training tools are integrated on our EMR. So whenever they are doing something, there's an alert that pops up that, doctor, do you want to do this in this way? Then risk calculators, definitely that are needed, because that gives an insight to the doctors on what kind of areas that they need to look at. And we have also designed a clinical pathway guideline for them, so that everything is not necessary that they remember. They can always, take help from the tool that's available. And in the EMR, what we have done is that we have given them critical information highlights, so that if somebody is diabetic, hypertension, or maybe on some kind of antiplatelet medicine, it is thrown to them very obviously so that they don't miss it. And then there are a lot of alert systems for patient, for doctor. Like if a doctor is just going forward without checking the previous EMR, we give them an alert saying, the doctor, do you really want to miss this piece? That checking the previous records are really, really important. So what we're trying to do is augment the doctor services. We are not trying to tell doctors that you become faster. We are automatically making them much faster, much better, much efficient, and much, very specific in their approaches. And then we have also made sure that the EMR that we have, the data capture that happens is very, very, very specific so that analytics can be done later on, because that was a major area of concern for us. There's so much of data, but we were not able to understand. And right now the government, working with NHM and a lot of other agencies of government, we have realized that government is also focused on impact analysis. You do a project, you do any activity, they are asking you what impact you created. Unless and until you have a very hygienic data, you can't show impact. So I'm getting a note that I need to finish it faster. I would have loved to, talk a little bit more about it. But then, I'll just talk about one or two tools that we are using right now, and that is that we are trying to calculate the empathy score of each consult. So that we have realized that there are doctors who take too much of time. There are doctors who take very little time with the patient. We want to give them that tool which gives that, doctor, we think that you spend very little time with the patient. You might have a valid reason for it. Maybe the patient came for a review, but we want to give them those alerts and then an empathy score for that this consult of yours was scored this much. Because it's all happens on the video and audio, we have those kind of tools to do that. And also because when we are giving these tools, we are making sure that the doctor is learning on itself and their images are increasing. We have developed a system wherein patient feedback, doctor's quality score, and empathy factor create their performance score basically. So that's how we are looking at it, and there's a lot more, but I think for the time's constraint, maybe next time. So what we are looking at is to augment doctors, paramedics, and patients in their interactions, and just make sure that we are not missing anything critical. We are creating a very good patient experience and a doctor experience. For us, doctors are also very, very important. Thank you so much.